Paula Nutting, your musculoskeletal specialist. Do you have problems with clients with tight hip flexors? I know that I do, and we've used a myriad of different techniques which include fingers, thumbs, needles, all which are quite excruciating and I don't believe great value for our clients. What if I can give you some tips to facilitate the actual quality of the muscle and also give it some strength? What we see a lot in our hip flexors is that they are stretch weak, so they're quite strong in smaller ranges, but when we try to take them through range, they become weak. When those hip flexors become weak, they don't support the lower back because they're attached at the anterior bodies of T12 and all of the lumbar vertebrae. So we need to facilitate and wake up the whole area, and we need them to give them some good homework to give them strength through that lengthened range. And that's what we're going to do today with Lindy. Lindy, can I get you lying on your tummy? We're going to assess and see how tight her hip flexors are just in that prone position. For the sake of the video footage today and not spinning tables around, I've got her lying in this position, but a warning, you'd never leave your clients in neck positions like that for too long because they can get hyperextensive pain. So to test our hip flexors, we're going to take the foot, knee bent, heel closed. You can feel quite good tight bind through there, and then we're going to lock that knee in that flex position and take the leg up. So we're actually conventionally, I like to use my body weight because it's good biomechanics for me, and I'm going to support her hip and I'm going to take her up. So I'm elevating the femur and I get a feeling and a sense of how tight she is, and I'm also getting subjective information. How's that feeling through there, Lindy?
Tight.
Yeah,
tight.
It feels tight. Up here mainly,
yeah.
And then along the line, because that's quite often what we want to know is it coming from the rec fem and the four quadriceps that attach to the knee, or are we getting the rec fem and also our iliopsoas? So we're going to do a little wake up first for the neurolymphatic points, and then I'm going to show you the strength. From this position in supine, we're going to get them to bend their knees up, and we're just going to get our fingers and we're palpating, finding the ASIS, AIIS, so we're getting the front of that ilium. We're just going to tuck down and just have a sense of how the muscles feel, whether there's tightness in deeper through there. And we've had a bit of a trick, and I've worked on one side already, so that doesn't feel too bad, but the other side is feeling quite tight. So we tested and worked out that this one was tight. We're going to come in through here and we're going to actually facilitate and turn on the neurolymphatic points. So many of you won't know about neurolymphatics because they don't teach them. Relax your tummy. They don't teach them in a lot of mainstream work, but we're just waking up the neurolymphatic endpoints to stimulate the hip flexors as a group, and that's only 30 seconds. They can do that at home. And if you want to know more about that information, then have a look at some of the other YouTube videos that I've got on the neurolymphatics. 30 seconds should do it. Now let's get her to have an understanding of what strength she needs to do. So our homework is all about explaining a position to have our clients to set it. So Lindy, I'm going to get you to put your hands on your pelvis. That's it. And you're going to take the leg that's affected. So in this case, it's her right leg. I'm going to get you to take it back for me, so that that's just behind where the acetabulum will sit, and the other leg is sitting forward. And you're going to posteriorly rotate the pelvis so she knows, tip the bucket backwards, and you'll see that the knee's slightly bent. So this range through here, we're going to only drop the knee down probably, 2 or an inch and a half if you're not from Australia, and 2 to 3 centimeters if you are. So we're going to tilt the pelvis backwards, and you're just going to stand up and then down and up. So we try to get them to stay really lock solid in this move so that the torso's not moving and the lumbar spine's not moving. And we're coming up and down. That is the end range strength. It's an actual eccentric contraction for our hip flexor group. And you're going to get them to do about 20 of them. Now Lindy's struggling a little bit with this. She's kind of can't get that leg straight because she's feeling a drag through there. And that's a good sign. So we're going to really make sure that you feel like you can keep nice and control through that range and really drive up through that back leg. So she's contracting her glutes, she's contracting through that whole pelvic region. And we're going to do 20 of those. Okay, let's retest and see how we've gone. So it automatically feels a little bit easier through that knee flexion as well, which I'm quite happy about. Locking down for biomechanics. This hand is underneath the femur. We lock down to make sure the hip's nice and stable. I'm going to come up. And can you see that that range has really improved? How's that feeling?
Much looser, thank you.
Give this to your clients. It might be one side, it could be both sides. Once a day, 20 is just enough, and you'll get great results, and they'll feel much better through the pelvis and lower back. I'm Paula Nutting, your musculoskeletal specialist.